Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. Today we are joined by Dr. Christopher Schmoyer of the University of Pennsylvania, and we are going to get a great overview of short bowel syndrome. It's something that I personally didn't know much about until I started exploring this topic with some of our experts, including Dr. Schmoyer. So we hope to bring you some great information that could help you or your loved ones. This episode is brought to you with support from Ironwood. And as always, friends, don't forget to like, subscribe, share, and write a review for the podcast and the podcast episodes. Thank you so much. Welcome, Dr. Schmoyer. Thank you for joining us today.
Of course. Yeah. Thanks for having me on the podcast. I'm a big fan of the podcast and all the patient education that you provide through it. So I'm really happy to be here.
Oh, thank you. It's such a team effort. So what is short bowel syndrome? And how does it affect the digestive system?
So short bowel syndrome is actually a really, really rare condition. There's maybe 10 to 20 people out of a million who actually have this. And really, the most simply is it's what happens when there's actual loss of intestinal length. And usually this affects your small intestine. Normally our gut, we're born with between 10 and 20 feet of small intestine. But that part of our body is the main area where we do the bulk of our digestion and nutrient uptake. So if you have an issue that leads to loss of intestinal length, and usually this is a surgical procedure where you just lose a bulk of your intestine, it can lead to significant symptoms in these patients. And people who truly have short bowel syndrome, they can develop profound diarrhea, dehydration even that leads to kidney failure related to that. And really nutritional deficits that require medical nutrition. Usually that means getting all the bulk of your nutrients through something called TPN, total parenteral nutrition, which is through like an IV line because they're so malnourished and not able to take in nutrients from your GI tract.
No, thank you for that overview. We're going to get into the treatment options and all that interesting stuff a little later. But let's continue to set the stage for really understanding what this is. And I know you said this was a rare condition, but for those of us who are affected by it, what are the most common causes of short bowel syndrome?
Yeah, I guess to fully answer that, I know your patients are really well in tuned with kind of the GI tract and physiology just by listening to this podcast, but for those of you out there who just might be new to the program, just a real quick overview of digestion in our bodies. I think we all know when we eat and drink, our food gets down into our stomach. The main job of your stomach is to kind of grind up your food, make it more liquid so that it can be digested farther down in your GI tract. So your small intestine, I think, is the most interesting GI organ, and the one we're going to be talking about the most today is where really all of your digestion takes place. So your small intestine is really split into three parts. The first part, your duodenum, the middle jejunum, and the last is your ileum. So the first part of your small intestine is where the bulk of digestion occurs, meaning like pancreatic secretions are dumped and then your bile is secreted. And that breaks down all the stuff we eat, our protein, fats, carbohydrates into smaller particles that we can then bring up into our bodies. And that's mainly what the rest of your small intestine does. So the bulk of actual absorption of the nutrients occurs in your duodenum into your jejunum, like the first half. And there's other vitamins and kind of fluids and things that are and hormones that are produced farther down in your small intestine. So once the liquid that we eat gets down into your colon, the job of your large intestine really is just to absorb some fluid and harden up your stool. So people who have short bowel syndrome typically have had surgery on their small intestine. So depending on where the surgery was, if a part of your duodenum versus your ileum is removed, and especially like how long that segment is, depends on the symptoms you're going to get. Essentially, all of the symptoms are related to malabsorption. If you are not able to break down and digest your food properly, that food actually, the nutrients in your GI tract then actually cause diarrhea. The fluid and all that kind of sticks into your intestines, and people get profound diarrhea, maybe 5, 10, even 15, 20 bowel movements a day. A lot of people with this condition actually had surgery that led to an ostomy. So they could have really profound ostomy output as well. Not just sometimes the diarrhea is enough that you can develop like kidney failure, especially in the early stages of this disease. But probably the most recognizable symptom is just weight loss. If you're not taking in all those nutrients, you're gonna really waste away. And then before we had good nutrient support, like people would die from this condition just because you weren't able to absorb enough nutrients to survive, and you would starve to death.
Yeah, this is what it makes it, such an important topic to discuss, because it makes such an impact on someone's ability to absorb nutrients and to thrive in life, and just to stay in life. And that's why we're talking about this today. And, we're not trying to scare people, but we also want to bring the positive side to this, is that there have been developments in the way that it's treated, which we'll get into. Who is affected by this? Like, what is someone born with a shorter bowel? Is it an accident that happens to them? Is it something like our patient, Lori, who had IBD, and that was one of the reasons why she lost her bowel, a part of her bowels, and has short bowel syndrome now? Like, what are some of the reasons that someone would have this condition?
Yeah, great question. You can be born with this. So there are certainly babies who have congenital malformations and other defects in your GI tract that you just, are never able to absorb nutrients properly. Most of the time, this is due to surgery. So, Crohn's disease patients who have small bowel inflammation are a prime example. If you've had multiple small bowel surgeries and if you lose enough intestine, this can certainly develop in those patients. More often, this is due to something kind of catastrophic. So patients, the week before are doing fine, don't know they have any GI problems, and then something happens. They have a blood clot leading to their intestines that leads to ischemia, and a large portion of their intestine just dies off and has to be resected. Or a lot of patients I see are trauma patients who've had gunshot wounds or, stabbing from like robbery attempts or something like that. And the next, you're eating normally yesterday, and now you have a life-altering condition.
No.
So it can definitely be, like you said, a really profound and abrupt change for some of these people who develop it.
No, it's so true. We take it for granted when we can eat, and we're talking about with the patient, she's just trying to eat to sustain her life. And we think about, the flavor and all of this stuff. And at the end of the day, it just boils down to sustaining your life. And it's, makes you kind of stop and go, wow. But on that note, what are some of the primary challenges in managing short bowel syndrome? I mean, you alluded to some of them, in absorbing enough nutrients, but what else are some of the challenges that patients face?
Yeah, I think part of the challenge depends on what the timeline is after this happens to you. Usually when people have these big bowel resections, you're going to be in the hospital, and those first couple of days to weeks are really the most significant in terms of symptoms and what we have to do medically also to make people feel better and survive. Especially if you have a more distal small bowel resection, the farther end of your small intestine secretes a lot of hormones that actually suppress your appetite and the digestive process. So people who lose that, especially, their appetite is just stimulated all the time. And they have their body is constantly producing all these digestive enzymes and fluids that are dumped into the intestine. So the initial period after the surgery you see profound fluid shifts. Like that's when the diarrhea is the worst. People can have like horrible electrolyte abnormalities and acidosis in the hospital. Those are things that usually we have to start like aggressive IV fluids and different nutrition treatments right away that kind of just stabilize everything. But people then almost universally have like terrible diarrhea and ostomy output immediately post-op. But that does improve for most people. That gives way to once we kind of can stabilize the nutrition aspects and some of the medical care and people are willing to be discharged home, our body is actually able to regenerate itself to a degree. So the next year or two are really key for patients with short bowel syndrome. Our small intestine, even though it's shortened, has an amazing absorptive capability. the entire intestine itself is lined with these villi. These are like finger-like projections that extend up into the intestine that increase surface area for absorption. Over the next year or so, those villi can actually elongate. They grow in size. The intestine that's left can actually somewhat increase in length. And all this increases our ability to absorb foods that we eat. So because of that, diarrhea tends to decrease a little bit over the first year or two just on its own. And the need for supplemental nutrition decreases. And some people are even able to wean completely off of it and get back to eating, relatively normally. But all throughout this time, what patients really complain the most about is bowel movements and diarrhea. And it's something that really has to be tackled through multiple modalities, but it by far is usually the thing that limits life the most for people.
I would imagine that would be, and it's a huge challenge. So on that note, if you're talking to a patient and their family members in the hospital and you're guiding them through the next steps, what does the management of this condition look like going forward? Once you leave the hospital, what do we need to know about how this is treated? Do we have options? How do we know what to take? Can we eat normally? Like, what does that look like?
Yeah, there's a lot to it if as you can imagine. So I guess the first thing that we can talk about is just how people get nutrition usually who have short bowel syndrome. And usually we start TPN, total parenteral nutrition, in the hospital. So this is the way that we can give someone nearly every bit of nutrient and every bit of nutrition that someone will need to survive. And then people do survive for years, even decades on TPN and do really well. So it's not all a doom and gloom diagnosis. There are plenty of people who live really long, fulfilling lives with this, but it's definitely a life-altering thing. So TPN is infused through an IV line. Usually you'll go home with either a somewhat temporary line in the arm. More often, it's given through a port or some other IV access device in the artery right on your chest. And patients and caregivers need to be educated because they're essentially doing this at home on their own. Then have to be able to set up the food for themselves, these IV bags, take care of their IV line, kind of connect everything. Thankfully at home, usually this runs overnight when patients are sleeping, but it still takes maybe 12 to 16 hours for some people to fully infuse. So it can have a big impact on lifestyle and what you're able to do during the day if you're still infusing and things at home.
What can patients expect when they're just diagnosed with short bowel syndrome? Like, what does that look like in terms of management? Are they able to eat regular food? What do we need to know?
Yeah, so patients definitely can eat regular food, and we absolutely encourage that. In that first year or two, it's very important for patients to maintain actually a high level of nutrient intake, because that the food that we eat is going to stimulate our gut to grow, that intestinal adaptation process to kind of take off. So what we really recommend people to actually do is adopt like a hyperphagic diet, we call it, where instead of eating like 3 large meals a day, if you eat a lot all at once, that will kind of overwhelm your GI tract and just it'll come out the other end, and we don't want to get diarrhea.
Right.
But these patients should really eat all day long, like frequent small meals, like constant snacking. But this is also where, a lot of management of this is very multidisciplinary. And I really require all my patients to meet with a nutritionist, and not just meet with them, but have a long-term relationship with a nutrition support person, because they really, more than anything else, what people take in with this condition affects what comes out the other end, how much diarrhea they have, but also our ability to wean off of IV nutrition support. So the big things, the more global recommendations for diet in people who have like short bowel syndrome, we really want, like I said, to eat all the time, but really focus on foods that are very high in protein. That's the bulk of where we're going to get most of the nutrition that we need. Fats are kind of neutral. You definitely need fats as well to absorb a lot of some of the fat soluble like vitamins and other things like that. There's actually fats that are needed for our bodies that we have to take up. But if you eat too many fats in the diet, that can kind of overwhelm the limited ability to reabsorb them and lead to worsening diarrhea as well, especially diarrhea that's kind of greasier and can lead to incontinence. So it's kind of a balance on how much fat can people take in. Carbohydrates, especially simple sugars, those should be limited because that can also really worsen diarrhea. So it's a constant like high protein diet that really takes a lot of tailoring for the person, the individual patient, because it depends on what part of the intestine was removed, some of the dietary recommendations, and also whether patients have an ostomy versus whether their colon is in continuity, still connected. That can all change some of the dietary recommendations.
It's so great to hear you and other of your colleagues, stress the importance of working with a nutritionist or registered dietitian that is well versed in working with patients with GI conditions such as short bowel syndrome. I love hearing this because it is a multidisciplinary team that can best manage conditions like this. So thank you for that. And I think our dietitian colleagues will be very pleased to hear how their role on the short bowel patient care team is critical. And patients too, because you want someone to help you know, like, okay, if I want to make sure I'm getting enough of this so that I'm not, having these effects. And dehydration, like you said, is a number one. And also, eating those simple sugars that break down really quickly, right, in the body. And they don't even have time to be absorbed, and it could cause lots of problems. So making tweaks in the diet with a dietitian can be, hugely helpful. The other thing I wanted to ask about is behavioral health aspects that are also common in patients with short bowel syndrome. And, do you also encourage your patients to work with a GI psychologist, for instance, or, is there pain involved? What other aspects of quality of life are impacted by this?
Yeah, that's. I'm glad you brought that up too. This whole multidisciplinary kind of team is so important for people who have short bowel syndrome. Not only the nutritionist, but we work really closely with the pharmacist who actually prepares the TPN. If people are, for people who are on that, there are nurses who check in with these patients all the time, but get for frequent lab work, any issues. There's always direct communication, but mental health is key. And it's something that I think is often overlooked in a lot of aspects of medicine. But people, this is such an abrupt change in people's lives. To be eating and drinking normally one day and then requiring lifelong like IV supplementation the next. People, it's a traumatic experience, and there are a whole range of how people respond to that. That those emotions come right at the most important time. When we really need to focus on so many changes in the life and in people's life, and major changes to the diet and what we're eating and just behaviors in order to optimize that time that we can grow the intestine back. So there's been, I've taken care of patients who've been so depressed or haven't been able to engage in care because of their mental health that have been so poor after this, that we really missed the opportunity to make a lot of these changes in the short term that really impacted them long term. So I absolutely but I refer everyone to mental health help, like GI nutrition, GI psychiatrists, psychologists, whatever's needed to really help them. It's a very important aspect of care.
Yeah, I would imagine. I try to put myself in the shoes of these patients, and it's almost like a grief of your former life, right? And there are stages. You have anger, denial, and then you also have acceptance. And to have someone supporting you with those stages can be can be critical. I'm glad we're talking about this because, it's not an easy path for these patients, especially if they're younger too, right? Younger patients. Do you see younger patients with this
Yeah.
condition?
Yeah, especially just from a mental health standpoint, usually the people that are affected the most are younger patients, especially when it's related to a trauma, like a gunshot or something like that, or really had really maybe no medical problems beforehand, and you're totally right. It's a profound like grief process that people go through that really it's so helpful to get an extra set of an extra voice, an extra set of listening to help you work through those problems. It's a big deal for people, maybe even more so than the medical part in a big degree.
Yeah, I saw we always hear mind over matter, and sometimes the power of the mind. If you can get your head in the right space, I mean, we see countless stories of patients who've gone through really traumatic situations, and they're doing great things. And it's not to belittle or diminish the gravity of their situation at the end of the day, but it's just to kind of give some hope to those who may be listening that there are care teams that work on all the aspects of the condition. So you're not alone. And it sounds like there's a lot of interaction with the team. It's not like, okay, you have this, okay, bye, let us know in a year how you're feeling. It sounds like it's an ongoing interaction. I think sometimes the nurses may go to the home to make sure the TPN is set up properly, because that's a big deal.
It absolutely is. But that's one of the joys of actually taking care of patients like this, because you have such a constant connection to them. And this is definitely true of some of the nurses in our nutrition clinic who really, a majority of our patients have these nurses on speed dial, have their personal cell phone, and really any issues throughout the week, even day to day that come up, you're able to always speak with one of us pretty quickly. And it's really, you're right. It's not like come back once a year. It's multiple times a week sometimes for patients that we're in communication.
To manage this condition on a day-to-day basis, like what are your maybe top 3 tips for success for patients that are doing this on a daily basis, managing on a daily basis?
I think probably the number one is what we were just talking about, that just understand that this is going to be a lifelong, battle, a struggle with this condition that you're going to need help to get through. It's very hard for anybody who has a chronic illness to manage well on their own. And this is no different. So, I just really encourage people, if they are feeling, depressed or desperate about what's going on with their bodies or their medical condition, just to reach out to really anybody on their care team. That's really important for this as well. Probably the hardest thing for patients who have this are the dietary changes that need to be made. Just because food is such a joy in our life, and then a sense of pleasure, and it's not that you can't eat with this condition. You're gonna have consequences if you eat the wrong things. You're gonna really have diarrhea, but the right way to eat can make a huge impact on quality of life. But it also takes a lot of buy-in. And it's not only the food you eat, it's type of liquids we're taking in. It's sometimes going to take a lot to learn the diet and the nuances of it, and how to incorporate that into your life. But the patients who do the best long term are the ones who are able to incorporate those changes the most, I think.
So is there anything on the horizon that patients should be aware of, developments in the way this is treated, or any new therapies that are on the horizon and maybe in clinical trials at this stage?
Yeah, absolutely. There is a great medicine we have right now to treat short bowel syndrome called T-deglutide, or Gattex is the name for it. It's essentially a growth hormone for our GI tract, for our small bowel. Really allows the small intestine to stimulate that growth and elongate, increase the villus length, and to allow us to absorb our food better. So people who are started on this generally see reductions in the amount of TPN they need. Maybe even get off of, instead of 7 days a week, maybe they only need to do it 3 or 4 days. Or some people even are able to wean off of it completely. So that's been a big an advancement in how we treat this condition. The downside to this is that it's the medicine itself is kind of short-lived in the body, and you have to give it as an injection every day. So some of the newer pipeline medicines that are coming out, including like apraglutide and others, are similar mechanisms of action, but are made in a way that ideally will last longer. So you will only need a weekly injection, or even more spread out, to improve quality of life.
No, that's great news. I always like to see what's coming down the pipeline because it does make a difference. Like a couple of years ago when we were talking about EOE, for instance, there was not a lot of treatment options, and now there's been several since then that have really made a difference for patients. So I always like to ask those questions. What are the long-term effects and prognosis of someone that has short bowel syndrome? Does it lead to surgery? Will they lose their entire intestine? Like, what is that in the worst case scenario? Like, what does it look like?
Yeah. So, worst case scenario, best case scenario would be that people do well with this. And I would say that's the majority of people who have short bowel syndrome, that we really get to a point where we can, through medications and dietary changes, control, the other symptoms like diarrhea. We can stabilize nutrition aspects, and people can maintain their weight and really live a fairly normal, fulfilling life in the long term. When that doesn't go right, a lot of times it's due to complications from either their underlying medical disorder that got them there, or from TPN itself. It's not the safest of things to have food directly introduced into your circulatory system. So you can get infections from it, and blood clots, like liver disease. And when these complications start developing, especially is when we start thinking about, is there anything else we can do medically to kind of correct what's going on? So actually, small bowel transplantation has been done for a number of years now. It's a very rare type of transplant, less than 0.5% or so of the transplants that we do nationally. And it's a more difficult process. The small bowels, just a harder technical organ transplant, and the medications afterwards often have to be like higher doses for immunosuppression and things. But that for a lot of people who go through that successfully, they are able to get off of all supplemental nutrition, really have a great quality of life afterwards, and are able to eat normally like they were before. This is just a chronic disease like any other. It certainly affects your life, sometimes more than other issues, but it can be managed. And if you stick with the diet, we do a good job of controlling your diarrhea for symptoms and quality of life. We can manage nutrition supplementally. People do well long term. It's really a minority of people who have significant complications that would require a change in what we're doing. But long term, like people can live totally normal life expectancies as long as if they do well. Yeah.
No, that's great news. Well, this has been such a educational and informative episode, and I really appreciate your insight. Thank you so much, and we look forward to having you on again sometime, maybe, if you're interested. But this has been interesting. Thank you so much.
Yeah, of course. No, thanks for having me. This was great. I hope everyone learned a lot from this.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.